Well, this past week, the FDA approved a second version of a groundbreaking new cancer treatment. It uses a patient's own cells to fight an aggressive form of the blood cancer, non-Hodgkin's lymphoma. Here's Dr. Tara Narula.
This fall, 54-year-old Scott McIntyre has his life back, running his trucking sales business and tailgating before cheering on his beloved Notre Dame football team. In 2013, he had been diagnosed with a type of non-Hodgkin's lymphoma. After several rounds of chemo and a stem cell transplant, he was losing the battle.
In the fall of 15, the cancer moved into my lungs, and that's when things were looking pretty grave.
But hope came in the form of an experimental trial run by Dr. Michael Bishop at the University of Chicago.
I've been doing this for 25 years, and this is the most remarkable advancement I've seen in my career.
In the trial, a patient's T cells, or white blood cells that fight infections, were removed from the patient, shipped to a lab, and genetically modified to recognize cancer cells. Those new cells were then put back in the body, ready to search out and destroy the cancer.
The median survival, unfortunately for this group of patients, is only about 6 to 7 months. So when we're seeing 40 to 50% complete response rates, that's markedly above what would be considered standard of care.
For McIntyre, his moment came on May 18, 2016, when a single infusion of his own T cells went to work on his cancer. 3 months later, he received a call from one of his doctors.
She says, well, you're my walking miracle. She says, everything is fantastic. You're actually showing no activity of cancer anymore.
Now that it's approved, estimates are about 15,000 people with this type of lymphoma might be eligible for the treatment. And there's hope that in the future, this type of therapy may also be used to treat solid tumors like colon and lung cancer. Rena?
Dr. Tara Narula, thank you.